Indiana's largest healthcare network defrauded taxpayers of $100 million. That's according to charges brought by the U.S. government and a local doctor. Good evening, everyone. I'm John Stair.
I'm Anne-Marie Tiernan. It's now 6 o'clock. This recently unsealed complaint says IU Health and HealthNet were cashing in while risking the health of low-income mothers and their babies. 13 Investigates reporter Sandra Chapman sat down with the whistleblower behind the claims. Sandra?
Dr. Judith Robinson had a unique glimpse into both maternity programs at IU Methodist and the HealthNet clinics. She served as the medical director of both. In fact, she says it was 3 cases of permanent damage to babies and moms and 17 near misses that prompted her to speak up.
The most egregious part is that these babies and their mothers suffered and didn't need to.
In her first television interview, Dr. Judy Robinson tells 13 Investigates she couldn't believe how low-income women with high-risk pregnancies were failing to get appropriate doctor's care under the watch of IU Health and its network.
IU Health and HealthNet wouldn't allow us to.
Instead, the women were allegedly treated by midwives with less training at partner HealthNet clinics, despite federal Medicaid rules saying it does not permit treatment or referrals to non-physicians for high-risk pregnancy-related services. Robinson says along the way, moms and babies were harmed for life.
This would not happen at IU North, IU West, suburban hospitals. You don't have this type of process. Why is it allowed? Why is it okay for the people there?
According to Robinson, in the $100 million federal lawsuit, IU Health failed to provide crucial doctor services, but billed Medicaid at the doctor's rate in those same high-risk cases, knowing midwives actually provided the treatment. According to the complaint, it was a financial scheme in which IU Health collected 3 times more by listing a doctor as opposed to a midwife. In another email, the chief at HealthNet reportedly writes, certified nurse midwives get paid 1/3 to 1/2 what OBGYNs get paid.
It's rather astounding, but I guess that financial aspects are more important to some large health institutions rather than patient care issues.
Dr. Robinson says it dates back to November 2010 when she got this email about high-risk moms being treated one night without appropriate physicians on hand. The staff member writes, "We are not staffed to optimize patient safety, physician safety, or patient satisfaction." Robinson says she alerted top administrators, but 6 months after she says she offered up proof, she was fired.
As a physician, as a person, I can't turn the other cheek to just say, oh, that should be allowed.
Robinson says she was offered another position with IU Health if she would sign an agreement to keep quiet. She is also suing for wrongful termination. Now, we reached out to IU Health tonight. In a statement, the health provider says, in keeping with its own corporate policy and out of respect for those involved, IU Health does not comment on matters involving active litigation, but is cooperating with requests throughout this investigation. John?
All right. Thank you, Sandra.